undergraduate education was at University of Chicago in Chicago, Illinois. I decided to choose that school because it was outside the area where I was growing up, which was in Texas. And it was a great experience for me. I then went back to Texas and was in the process of pursuing a PhD degree. And then I changed my mind and decided to go into medicine. So I applied to medical school, and I attended medical school at St. Louis University Medical School in St. Louis, Missouri. And that has kept me in this area, and my family is now here, and we are loving it. Well, if you ask any doctor, it's always been a childhood dream. And that same scenario for me, it was one of those things that I always kept in the back of my mind. I think the final thing that made me really want to pursue medicine was I was able to see some of the relationships that you're able to establish with other people. And you can do that in any other occupation as well. However, in medicine, you have a little bit more of a closer relationship with people. You know a little bit more than just what's on their normal resume. And I think it's also an opportunity to help improve the life of someone else in a way that they may feel helpless in. So I think medicine has really suited me because I think I'm able to connect with some people on that level. Since I went to school here in St. Louis, I already knew of the great reputation that Barnes-Jewish Medical Center and hospitals, as well as Washington University, had in the community, not only local community, but national community. And I was very impressed with their approach to medical care. They also not only empower the physicians with ability of making their own medical decisions based on what they believe is best for the patient, but they also empower the patients a lot by providing them with not only access to some of their medical records or laboratory results, but they also really try and facilitate the patient's access to their physician. So I was very comfortable and very impressed with the way BJC operates for the physician as well as the patient. Each of the three physicians in our practice have a little bit of a different interest within primary care. I really like working with the adolescent population. I think they are a wonderful group of people that are sometimes overlooked because they're usually in general good health. But there's a lot of great opportunities to intervene at that age to start preventative medicine, to start to discuss high-risk behavior and things that you can do to improve your health now or maintain your good health now to prevent disease in the future. And I think the adolescent population is one that is kind of hard to touch with because we don't see them as often and as regularly, but they're probably the one group that I really think needs to have more concentrated medical care directed at. There's one thing that I do every year is I go on a medical mission to Peru, and I join a small group of physicians from the St. Louis area. We provide free medical care to a school that ranges from age 3 up until high school, and we also take care of their families as well as the teachers and their families. Each afternoon we go out to a different location in that area, like a church or a schoolhouse or into a farm community, and we provide some care also in those areas. And it's really nice because since we go to the same places every year, we see some of the same people coming back, and it's nice to be able to follow up on some of the medical issues that might not even be followed by any physician in that area for that whole entire year.